a Q&A straight up. If you allow me, I just want to quickly show, I'll share my screen to quickly give an update on certain things that may elicit questions during the course of this.
Yeah, you should be able to. But while you share your screen, Dr. Jaumdally, just to say that, but just to formally welcome everyone who's here, and just to say that we really would like to create a very safe space for you to ask any question that you have. I think one of the big challenges is that there's so much information out there, and we're all receiving it on our WhatsApp groups, and it can be very distressing and overwhelming to determine, how do we know what is right? How do we know what is wrong? And I think, in times like these, it's very important to appeal to experts. And that's why we've asked Dr. Jaumdally to be here today. And how we would like to structure the session, I see we've got about 17 people here, is that if you have questions, you're welcome to type it on the chat, or you can also raise your hand and we'll unmute, and you can ask your question in that way. But we just ask that, because this is a online session, just to lay down some ground rules, that we recognize that we respect the space also, so that we ask our questions in a respectful way, and we give the opportunity to have a civil discussion, because sometimes it's possible that these things can actually get out of hand. So we ask and we plead that because we're allowing the participants to ask questions in this very open setting, that we have some structure with regards to that. So Dr. Jaumdally, please, you're welcome to share your screen.
Thank you, Elias. Please let me know when you can see it on your side.
Yes, you can see the screen.
Okay, so basically, as mean of introduction, what I just want to give a quick background on is the situation in terms of COVID right now in the country, and also the situation in terms of the vaccination in South Africa and globally. So in terms of the numbers, we all know that we've already experienced 2 waves before, and we are right now in the middle of our 3rd wave. And from the chart on the left, you can see the red line, which is Gauteng, of cases that increases exponentially, and that are still more or less at a similar level, with sporadic drop now and then, but that is obviously because of the number of tests that can be done in one day. What we need to rely on as an indicator of how risky it is right now to be around, to be moving around, to be in the presence of other people, is the positivity rate. Any positivity rate that is above 20% present a very significant risk of actually exposing oneself to getting COVID. And right now, as of yesterday, I believe the positivity rate was close to 30%, which is almost 1 in 3 person, 1 in 3 person testing with symptoms, testing positive for COVID. And I also want to highlight that the data and the statistics that are being reported, especially with regard to the death, is actually what we call official and confirmed sources. But what we also know is that there are so many people who go undiagnosed, who go untested, and there are also deaths that are not directly accountable by COVID, but indirectly accountable by COVID. For example, people who do not have access to medical facilities because of the hospital being full with COVID patients, and because of the reduction in the number of primary healthcare services, such as diagnostic services for certain infectious diseases like tuberculosis, or access to treatment or diagnosis of certain more chronic conditions like cancer, for example. So the excess death that has resulted during the last 2 waves has been extremely high. And we know that these deaths are directly or indirectly due to COVID. So the figures that you actually get reported every day is not, like the complete picture. And that's one thing that I wanted to highlight, it in case people still believe that, COVID is only causing like so many deaths, and only affect a certain type of people. it is more than that. And this is something that I feel needs to be highlighted. Now coming to the crux of the matter, which is vaccination, we have two vaccines that have been rolled out in South Africa so far. The first one is the Johnson & Johnson vaccine, which has been started as a rollout in the healthcare workers who are the people who are, one of the group of people more at risk of actually getting infected based on where they work and who they get exposed to, which are the patient. And then we've had, fortunately, access to Pfizer, which so far remains the best vaccine in terms of many indicators that we can evaluate it on. And these two vaccines have been rolled out in healthcare workers. Now we have the teachers, and obviously in people who are above 50 as of recently. So again, to complete the picture, we have 3 vaccines actually that have been approved by our authority. Our authority that I'm referring to is called SAPRA. It is basically the equivalent of the FDA in America or the EMA in Europe, which are a group of people who have training and who have the capacity to give the accreditation and the approval for any form of biomedical intervention that wants to be practiced or rolled out in a specific community in South Africa. For example, it could be a treatment, it could be a vaccine, or it could be even, the use of a machine to diagnose something. So the 3 vaccines that we have that have been approved by SAPRA so far are the Pfizer vaccine, which uses an mRNA system. And this vaccine provides what we call 2 things: sterilizing immunity, which means that it can protect you against infection and against transmission of the virus if you do get infected to a certain degree, but it also protects you against severe disease, and that has been confirmed to a very high degree. Then we have the Johnson & Johnson and the Sinovac, which are both adenovirus vector system. Basically, what it means is we use an inactivated virus that normally causes the common cold in people, and we put a piece of the code that encodes that produces the envelope of the coronavirus inside the system, and that is taken to your cells inside your body to help elicit an immune response and a memory that will protect you in case you do encounter the real virus. So the adenovirus system for Johnson & Johnson has been shown to protect against severe disease to a very high degree, but I want to reaffirm and I want to highlight that there has not been any proof that it can protect against infection. And the Sinovac has been shown to protect against severe disease to a moderate degree so far, but we're not going to discuss too much about this because it has not yet been rolled out in South Africa. The table that I have included there is just to give you an indication of, firstly, you can see in that box that I highlighted there that the vaccine process is a process, and the vaccine evaluation process and the manufacture and the development, it normally takes time. So a lot of fear and a lot of questions have arisen based on how fast we got that vaccine. So I know there will be questions around that, and I want to actually get into that matter now. Though we have scaled up and we have fast-tracked the provision of this vaccine, the one thing that I can guarantee you is that there is not a single element that would normally be part of any vaccine development and trial that have been bypassed. What has actually happened for us to have these vaccines rolled out so quickly is that the effort in terms of human capacity and brain and in terms of the money that was invested was so substantial compared to any other diseases that has been studied by mankind so far, that we managed to combine this effort both financially and in terms of brain power to fast track the development of an effective or multiple effective vaccines. So steps like animal testing has not been bypassed. These have been done in parallel because we were finding ourselves in a situation that we call an emergency situation. There is an urgency to make the vaccine because many people were dying, but also because we knew that if we did not have that epidemic under control, it would be allowed to mutate to an extent that by the time we do get vaccine that will work against what would be formerly the previous or the first few virus, if it mutates, it's going to be very difficult to control it. So that's one of the things that I wanted to highlight, and also look at the second laws rule that talks about the adverse event. You can see that for the Johnson and Johnson, it carries an extremely low risk, which is anaphylaxis or basically an allergic reaction, or what has been commonly reported with Johnson and Johnson and AstraZeneca, the thrombotic event, which are like the result of blood clots. Regarding Pfizer, again, the anaphylaxis or the allergy responses to getting the vaccine has been extremely low, and we'll get into that later. And finally, to wrap up like the vaccine side of things, I just want to confirm that both Pfizer and Johnson still carries a significant efficacy against all the variants that we have in circulation, and these have been confirmed through either real life setting where people in the general community have received the vaccine and have been protected against the development of severe disease if infected with this variant. So the beta variant is what used to be called the South African variant, and the delta variant is what used to be called the Indian variant, and that is predominant in South Africa right now. And you can see that for both of them, the level of protection conferred by both Pfizer and Johnson is still there. And finally, I'm going to end with a comparison of the situation here and three countries that have reached quite a high level of vaccination so far. So what you can see on your left there is the picture in South Africa. The blue graph is showing the cases and the three waves as we know by now. The middle one is showing the death rate that you can also see is increasing as we go through the third wave right now. And the bottom one in green is the amount of vaccination that has happened so far. And as of the 1st of July, there were only 5.4% of our population that had received at least one dose of the vaccine. Now compare this to the United States, which is the schematic that on your right. So in the United States, you can see that from the moment of initiation of vaccine, which is around the middle of January, and until full protection has been conferred around 6 weeks later, which would be at the beginning of March, you can see that this coincides with a drastic decrease in the number of deaths, as seen by the graph in black. And this is something that shows the efficacy. And now if we go to the next slide, which is Israel, on the right-hand side, a similar picture is seen, whereby when the immunity conferred by the vaccine starts to kick in 2 weeks after the second dose, and in both of these countries, they've received the mRNA vaccine, which are Pfizer and Moderna, you can see that the death rate has also drastically decreased to almost zero. And the number of cases in both Israel and the US have also decreased to a very, very low number. But however, if you look at the picture in the United Kingdom, so we can see in the middle tier there that the death rate has fallen as vaccination goes up, but we can also see that the number of cases is still going up as of recently as last week. So what this shows actually is that the vaccines have different efficacy. There are certain vaccines that will protect you against both the transmission, the infection, and the development of severe disease. And there are other vaccines, for example, the one that was rolled out in the UK, the AstraZeneca, for that matter, that will protect you against the development of severe disease, but it will unfortunately not protect you too well against an infection. So this is why we ask people to keep wearing their mask, to keep making sure that they respect, all the measures that has been put in place to minimize the risk of transmission. And finally, I just want to highlight that, right now, it is mostly the developed world, the more rich countries that are getting access to this vaccine. And, as African, as people staying in Africa, we have always been marginalized in some ways towards, like the receiving something that is good, for humanity or good in normal life. And I want to say that this is also exemplified by the vaccine demand and the vaccine supply right now. We see that the more wealthy country, the more affluent country are the ones who are actually getting access and most of the access to these, and this is to the detriment of the lower middle and middle income country like South Africa. From that, I'll just take your question. I will stop sharing screen. I just wanted to highlight these few points.
Yeah, thanks for that, Shameem, for that very, very insightful presentation. So I'd like to, at this point, just open up the floor. I see Anne Hobson, you've raised your hand. Please, you're welcome to unmute yourself, or you can type in the chat. And you currently here?
Yeah, I've got. Good day, sir. I would just like to ask one question, okay? I contracted COVID, and how long must I now wait before I can get a vaccine? I am a teacher, so I would probably like to have that because I know I would expose myself to it more often because of the volumes of children we see. But somewhere science is leaving me in the lurch because I cannot understand how, if you've had the real virus, how that cannot protect you better than a vaccine, whatever one it is. I was up for the Pfizer. I've now missed it 3 times because of having COVID. And there's different stories that come. Some say, I know the government health organization says a month after it, you can vaccinate yourself, but other doctors and pulmonologists say, no, wait 3 months because you can have serious side effects. Can you perhaps just clarify this for me? Thank you.
Thank you for your question, Anne. So yes, I will respond to your question with 2 answers. The first one is with regard to the timeline that you need to wait to be able to get your vaccine. Right now, the timeline that we ask people to wait for or wait out is 1 month of the complete resolution of your symptom. I want to repeat that. It's not 1 month after your diagnosis. It's 1 month after the complete resolution of your symptom. And the reason why we actually preconize this and we advise this is because we know that there are certain people who will get like moderate or more severe COVID who will still have a lingering, effect of the infection through the inflammation that it has caused, through what we call activation of the immune system that it has caused. So we don't want to make these symptoms worse by the administration of the vaccine. So to be able to clear that and wait out that period, we advise 1 month. So now, to come back to the 3 months that you were referring to, I understand that there are certain people who are advising that we wait out 3 months for people who have already been infected, because all these things generally needs to be driven by data and the findings that we get from studying, people, or the effect of getting infected and how the immune system responds to that. So people say that you can wait 3 months because we know that the natural immunity that gets conferred through a natural infection or an infection with the virus, which is like a natural exposure to the virus, lasts around 3 months. Now, the last part, which is, so if you've had COVID and if you've been exposed to the virus and if your immune system has actually, registered what the virus is and how to fight it, why do you still need to get the vaccine? Because clearly people would think that, this is enough protection. I have not developed severe disease. I have not died from it. So I should be okay now. So what I can tell you is that when you develop natural immunity to any form of bug, whether it's a bacterium, whether it's a virus, there are specific arms and specific types of cell in your immune system that will be primed, that will be activated, that will be switched on to respond to an actual exposure or an actual infection. And what we know from studying people who have developed natural immunity after infection, and what we know from people who have developed artificial immunity after vaccination, is that the vaccination, whether it is Pfizer or the Johnson & Johnson vaccine, we know that it it gives you an added layer of protection that you do not actually get conferred when you get in an infection and develop natural immunity. Part of these, for example, are the T cell responses. There are other groups of cells that are also involved in the whole picture that would not normally be activated and primed when you actually get a natural infection. And for that matter, you can see that certain people who have been infected get reinfected. So you are not protected against a reinfection if you have already had the virus. Whereas the Pfizer vaccine, for example, has shown to have better efficacy at preventing an infection. So in brief, what I'm saying is that the immunity that is conferred by the vaccine is higher in magnitude. That is, it is better in efficacy, but it is also something that lasts longer in your body. And this is why we also advise people who've been infected to have the vaccine, because it still decreases their chance of getting infected down the line, and it still increases their chance of not developing severe disease down the line. I hope I answered your question.
Thank you very much. You did. Thank you very much.
Shameem, there's another question from Amaro, which say, and Dakira, which says, what are the stats regarding vaccine-related deaths in South Africa, if any?
Yes, thank you for this question, Amara. So basically, I can talk about the Johnson & Johnson, okay? So I want people to understand that when it comes to vaccines rollout, especially when it comes to something as new as the vaccine that we're using right now, the people who are responsible for the rollout of this vaccine have the responsibility to make sure that the safety profile is confirmed even after the rollout of the vaccine. So the way this is done right now for Johnson & Johnson, for example, is that we have a group of people who have been mandated to follow up on any adverse event that result after the administration of the vaccine. And I'm talking about the Johnson & Johnson right now. And I can tell you, as of the end of last week, in South Africa, there were around 350 reports of adverse events following administration of the Johnson & Johnson vaccine. Of those 350 thereabout adverse events, 92% of them were judged to be minor and of no big relevance or significance, in the life of the person. A further 6% were in cases who had more moderate symptoms, and some of them required hospitalization. And there were a further 2% of those about 350 people who had what we call most severe adverse event that required hospitalization and possibly more work out to determine what is wrong and if there is any link to the vaccine. There has been one death that has been reported following the administration of the Johnson & Johnson vaccine in South Africa, and I can tell you confidently that this has already been shown to not be related to the vaccine. So in terms of the stats, I'm not only talking about death, but I'm also talking about the serious adverse event that requires hospitalization or any form of medical support or assistance is being monitored by a specific group of people for the Johnson & Johnson. And I am sure that the same thing is happening for Pfizer. And this is not something that's only happening in South Africa. There are things like that that are prevalent in the UK, in America, in Belgium, in the Netherlands. And I want I am pleading with people to not just believe about everything that you see in terms of, like the side effect or the death or the bad things that are resulting from the vaccine. You can go and look. I encourage people to go and find out for themselves. This is knowledge. Knowledge can only make us better. But in your search for this knowledge, please make sure that you actually use vetted, validated, trustworthy sources. I can tell you, for example, that there are many of these databases that are bogus databases where people from just about anywhere, I tried it myself. In the US, there are certain databases where you can log in, you can create a profile, and you can log in a call where you say that you received the Pfizer vaccine and this is what you suffered from. But yet I've never received that and I'm not even in that country. This is how easy it is these days to spread misinformation and to make up things. So I plead with people, for any form of information that you're looking out online for COVID and the vaccination, make sure that your sources are vetted or trustworthy and are reflecting what is factual and not misinformation.
Thanks for that, Shameem. Are there any other questions? You're welcome to raise your hand, type it in the chat. You can type your questions in the chat or you can raise your hand. But Mara says, thank you so much for the response. Perhaps just to follow up on that question, Shameem, is that that vaccine, that COVID-related death with the Johnson & Johnson, you said that was confirmed not to be related to the vaccine. How did they determine that, if I may ask? You're on mute.
Sorry. So basically, when you get anything like that, you don't necessarily, like do a full autopsy or, like you cut through the person to find out what happened. So there are multiple ways that people confirm any form of association or link. And obviously, the first thing that we go to would be the medical history of the person. And that will provide the biggest clues as to, whether the person was at risk of actually developing, any form of event that would have resulted in his or her death. It could be, like a cerebral event or like a cardiovascular event. It could be anything along that line. And obviously, when that happens, there are blood samples, there are tissue samples that are taken to make sure that this is not actually linked to the vaccine.
Okay, thanks for that. And then Rayan asks, what are some credible online sources that we can use? So I think this is in reference to the previous point you made about trying to find correct and validated information. Could you maybe give some examples of some online sources, Shameem?
Yes. So, I would generally use the domain as my most vetted way of trusting the information. So a lot of the government information pages, for example, in the US, it will always be .gov. So these are the ways that you can actually make sure that you are using something that is factual, something that is real. And also, you need to make sure that the platform that you're using or platform that are linked to people who know what they're talking about. Right now, there are so many scientists, and I don't say that they are like so-called scientists, but there are people who have like different interests and different vested interests. It could be financial, it could be just like mere attention seeking, who will be, requesting or like taking a platform to say what they want to say. And you need to make sure that when these people are speaking and you're listening to these people, can we trust them? For example, there's the case of this this veterinarian researcher. He's a veterinarian. He's a Belgian guy. He has been working on like a specific vaccine concept for a number of years. And he has been one of the guys who has been, like very vocal about not taking the vaccine and stopping the use of the vaccine. And eventually, when people dug a little bit more, they realized that this person who claims to be a vaccine expert had not published any form of vaccine-related paper since 1995. You can imagine that's like over 25 years. And that this person has actually had vested interest in the form of developing his own vaccine, and his own specific type of vaccine. So it is extremely difficult to know whether you can trust somebody or not, especially if you're not science trained. There are lots of terms that you can hear people speak about that may impress you and that may lead you to have the erroneous perception that this person actually knows what he or she is talking about, but there are underlying interests from certain people to say certain things, and you need to be extremely careful about that. So again, I would go for the government website, because COVID is something that is so relevant, so current right now. In all countries, you will have some form of government website that is going to supply you with the information that you actually need to make a concerted decision on the matter that is at hand.
Shameem, so Kotha asks, should people with comorbidities be concerned about taking the vaccine? Obviously very relevant now, over 50s being encouraged to register. What is your opinion on people with comorbidities?
So basically, to respond to this question is no. The person with comorbidities and comorbidities that put them at greater risk of developing severe disease if and when they do get infected, are the people we want to protect through vaccination. So these are people who have like a weight problem, whether they are overweight or obese. These are people who have hypertension. These are people who have diabetes. These are people who have like a history of cardiovascular disease to an extent. These people are the people who are more at risk of developing severe disease. So no, these comorbidities should not stop them from getting the vaccine. These comorbidities should actually encourage them to go take the vaccine. What is known is that there are people with certain allergies who need to be more careful about what type of vaccine they can take. And I'm sure that there will be questions that come through later on about this. But what is normally done right now, if somebody is known to have allergies to multiple agent, medical agent or biomedical intervention agent for treatment or for, like prophylaxis as other vaccines, these people are either given one or the other based on the anaphylaxis or allergy profile that they show. So, and then people who are constantly exposed to the virus and who actually want to get the vaccine because they want to be protected like healthcare workers, but who are known to have developed allergies or severe reaction to previous vaccination, what's being done for them is that they are vaccinated early in the morning, they stay in a hospital setting, and they are monitored, and when they feel better in the afternoon or in the evening, they're allowed to go home. So even when it comes to people with allergies, there are channels and strategies that have been put in place to deal with any form of allergy that can result from receiving the vaccine. And so far, no, comorbidity should not limit people from going and getting the vaccine. It should actually encourage them to go and get vaccinated.
Okay. And Vicky then asks, what advice do you have for those who have rheumatic and musculoskeletal disease if they want to take the vaccine? And then in addition, she's asking, please comment on the vaccine and those who are on immunosuppressants.
Yes. So with regard to certain inflammatory condition or a lot of the autoimmune diseases, there has been a call to be more cautious, because we know that a lot of these diseases come with inflammation, and inflammation is the main cause of the pathology and the problem that arises in these chronic condition. And the effect of the vaccine transiently is to cause that inflammation to shoot up. So somebody with like a normal inflammation profile like myself or yourself, Ilyas, when we get that vaccine, we can develop side effect. Side effect are like, minor little things like a headache, like a fever, like chill, like lethargy, like joint pain. We will get that because our response, our body's response to that vaccine, which is part of the virus, is inflammatory in nature. And this is what causes it. And this is transient because the vaccine, when it is inserted in your body, it will not stay there for a week. It will only stay for a few days. And after those few days, when you look into the body to try to find traces of that, it's completely gone. So it will get in there, it will stay for a few days, it will do what it needs to do, and then it will be disintegrated, okay? So for me, I'm not a clinician, I am a scientist. And when it comes to clinical aspects of like, what are the advice that are given to people with certain condition that requires them to be an immunosuppressant, such as people who receive like organ transplant, or people with autoimmune condition. My advice would be to consult their physician, their family doctor, or their GP, the person who knows them, the doctor who knows them and their medical history the best, and to also defer to the person and the doctors at the site of vaccination. Every vaccination site has a doctor or has multiple doctors in charge who have been briefed about all these possible, medical profile, and is it okay or not to actually get vaccinated.
Okay, thanks for that, Shameem. Just a reminder, I do see there are questions on the chat, which is great. If you want to ask a question directly, you're also welcome to raise your hand and unmute your mic, and we'll tell you when we come to that. The next question from Basil says, there's a lot of uncertainty amongst people who have been vaccinated, what they must look out for or do immediately after receiving the vaccine. There's been mentioned about clotting, etc. I think you have addressed this, but maybe you can just emphasize what advice you would have.
So there is one thing that I can actually advise people, and that advice that I'm going to give out now comes from our own way of evaluating the vaccine safety and efficacy in the trials that we have been involved in, for example, for AstraZeneca or for the other vaccine that we tested, which is called Novavax. So what we basically do is we give people a code. It is basically a code that contains certain indicators that they can monitor at home. For example, their fever. For example, any other signs of like headache or myalgia, or like irritability, or like decrease in appetite. So what I would advise people to do after receiving the vaccine is to keep like a small notebook or even a page where every day they keep a diary of, have they had fever? Have they had chill? Have they had a reduction in their appetite? And this is one way of self-monitoring that, you are not doing too badly, but you also, like not progressing in the severity of what you are experiencing. So this is one way of actually doing that. And obviously the other way would be, again, like for me right now in this time of like uncertainty, and in this time of, like hard access to doctors, I would advise people, if they're scared, to speak to their family doctor or to their own personal doctor who they have trust in, who they feel more comfortable with, and ask that person, I am going for my vaccine now. I am a bit worried. I have heard about these side effects and all these clotting and all that. Can you please be available if I feel that, like, my body is responding in a way that is not normal and that requires me to have a checkup in case it is something that is serious. So these are two ways that I think people can get across and over, that whole fear of what happens after vaccination. Keep a diary, take your temperature, monitor your headache, monitor your changes in your daily routine, and speak to your physician or your family doctor or your own private doctor who you trust, and make sure that this person will be available to hear you and to see you if you have any form of doubt on, like what the vaccine is causing in your body.
Thanks, Shameem, for that. So the next question is from Mia, who's actually due for the vaccine this week, saying that there are quite a few videos going around about, how the vaccination is going to be our death in a few years' time. I think there was a video saying that in 2 years, it's going to kill certain parts of the planet, and people saying that there are HIV strains and malaria, etc., in the vaccine and not tested properly. If you could unpack that, Shameem.
Yes. So definitely, I can tell you, like, for sure that there is no HIV, there's no malaria. These vaccines are like highly monitored. Every batch that gets sent to South Africa, and I'm going to stick to South Africa for now, are actually tested by the local authorities to make sure that the purity, to make sure that the contamination risks are all, like on par with what we want. In terms of the safety of the vaccine over years, I want to tell people and remind people, if they knew about that already, is that I know people are worried that we are using new system right now. We're using the mRNA system, which people say is being rolled out for the first time. We're using the viral vector system like the Johnson & Johnson vaccine or the AstraZeneca, which is also new. But these vaccine systems have been in use for more than 10 years. For the viral vector system, which is the one that Johnson & Johnson uses or AstraZeneca uses, these are systems that have been used and tried for over 15 years now in the development of an HIV vaccine, in the development of a TB vaccine, and the profile of these people who have received this vaccine have so far stayed safe. So this is the long-term safety profile of the system itself. Obviously, we may have a system, but we're talking about, a system that is carrying something different, that is trying to fight a different disease right now. Let's take the example of Ebola. Ebola was a big problem around 6 years ago in like Western Africa and Central Africa. And it was killing people at a rate of 95%. It had a fatality rate of 95% in people who would get infected with Ebola at the time. And there was a dire need to develop a vaccine against Ebola because it was something that was not going away. It was prevalent in these areas for a number of years, and there was more of a need to actually develop a vaccine. And the vaccine that was developed against Ebola by Johnson & Johnson is a vaccine that makes use of the adenovirus vector system. And I can tell you that for the past 6 years that we've rolled out this vaccine in form of a trial first and then in form of real life use into the normal general population, there has been zero safety concern. Why did we not hear about any of that, in these people who receive these types of vaccine? Now, because you have a global epidemic and it's not just touching like a part of a continent or a part of like a country, you have more of these things that are coming out from people who want to spread misinformation, who want to spread like conspiracy theories. And for me, the safety profile of this vaccine has been checked, has been vetted. If they have not been, it would never have been put to use at such a global scale. And if you are in any doubt, it has been over a year now that we've started trial for many of these vaccines, including AstraZeneca and Pfizer. And so far, the safety profile, the long-term safety profile, and I'm obviously talking about 1 year, has been extremely good. And we also do know that any form of adverse event or serious adverse event that can result from the administration of a vaccine would normally occur within the first few weeks, if not days, of the administration of the vaccine. And after that, if you've not had any problem with that, you should rest assured that you are safe and you don't need to worry about it.
Okay, thanks for that, Shameem. If there are any other questions, please feel free to post it on the chat. I see there's another one now that says, one of the main concerns is for some reason that the vaccine has a microchip, the nanoparticles, and how would you respond to someone who is convinced that they're going to be microchipped?
Like I really struggle to sometimes understand, like, the belief of certain people regarding, like, like a lot of these conspiracies that are spreading around. I mean, you need to ask yourself the question, like, people are investing so much money, like, to make a microchip and then put that in a vaccine and then inject that in you for what? Like, like, they talk about Bill Gates, they talk about all these big people. Like, what would they benefit from, to have a microchip inserted into somebody who stays, like, like in a township, like in South Africa, or like in Mitchell's Plain, or like in any other area for that matter? What is their purpose to actually have this microchip inserted? I also want to give a little bit of background on this whole microchip thing. And I think, just to also let people know how this story came about, was there was a project that was going to be developed by the Bill and Melinda Gates Foundation, where they were going to have a barcode that would be, stamped on the body of a person receiving a vaccine. This barcode would have its utility in countries where it is extremely difficult to have any form of medical record, either electronic or in paper, to know who has received vaccine and at what time. For example, in Africa, for example, in India, there are lots of instances where people do not have a vaccine record because they don't have the means to keep that. So what they wanted to develop was a barcoding system that would be made out of an indelible ink that you can't see. Using your own eye, you need to use UV for that. And that was going to have all the information about the vaccination, when it happened, what type of vaccine it was. And I think from that, people escalated this to a microchip. And there is absolutely no truth in that. As I said, you need to ask yourself the question, why would these people bother to invest so much money? I mean, what do they get to gain from that? Like, what do people think, that we're going to be converted in robots? And just to also, like, put it out there, that I have advised my whole family, my brother, my sister, my father, and my mother, to get the vaccines back home. I'm from Mauritius. They're getting different form of vaccine there. I am not happy with some of the vaccine that they're rolling out there, because I don't think that it has durable immunity and that it is effective enough. But this is why here I keep reminding people that we are getting amongst the best vaccine that have been confirmed to work against variant. Pfizer is the best right now. Johnson & Johnson has already been proven in clinical trial, not laboratory work, that it is effective against both the Beta variant, which was formerly the former South African variant, and the Delta variant, which was formerly the Indian variant.
And I see Vicky says that she's quite an otherwise fit 68-year-old COPD, but with both Pfizer vaccines, she didn't have any side effects, but still remains cautious. You're welcome to type any other questions or raise your hand, and we'll unmute. I know that some people also want to know what is the efficacy of the first Pfizer vaccine, in that period between when they get the first and the second one, if you could address that, Shameem.
So, there are anecdotal reports that are coming out now in South Africa from doctors who are actually, interested in the vaccine and its efficacy, and also, have at heart the well-being of their patients, especially the older one. And I've had anecdotal report of people receiving their first dose who have actually been protected against the development of severe disease when they've had the infection, especially right now as we go through the third wave. We know generally that after the first dose, you have an immunity that is at a level of around 30 to 40% that is attained. And the highest immunity, the best optimal immunity, is generally achieved 2 weeks after the administration of the second dose. But there is element, anecdotal element, but also peer-reviewed printed data in journals that we can trust, that show that even after the first dose, you have an element of protection that can keep you away from a hospital if you do get infected.
And then just building on that, Shameem's Rayan asked, what is the purpose of having multiple vac doses, and why is it that, some vaccines only a single dose, why is the Pfizer dose, multiple?
Sure. So right now, the only vaccine that comes in one dose is the Johnson & Johnson vaccine. And to be honest, I believe that as we go through the motion, we will probably require a booster dose at some stage. What we have found from studies is that it does provide a high enough protection over a long enough period to keep people protected against severe disease. But generally, the way it works is the first dose is a priming dose. So it's basically to introduce your body to what the virus looks like. And then the second dose is the one that will help you to keep a longer term memory. And you know, it's extremely difficult for me, even as an immunologist, to put that in very simple terms and explain to you how the immune system works. But basically, it's like, you know, you go for an administrative task, like, you know, you're applying for something, or you are applying to get your driver's license. The first thing that you need to do is to do your learners, right? You pass your exam, you know, the driving code and what you need to have as information, and then you go for your driving test, where you actually take the car and go out on the road. And this is exactly what it is. The first one is to habituate yourself, is to familiarize yourself with what this virus looks like. And the second one is to put it in practice. There, you already know what it looks like now. Tell me that you can develop a memory and keep it as a record in the immune system, so that when we do encounter that virus at any time, it will be a force trigger to react and to fight it off.
And then Razi asks, is there any validity in the fertility claims with regards to the vaccines?
No, very, very simple answer. I will explain to you what happened over the course of some of the trials that we had for the vaccines. Okay, so when we enroll people on the safety phase, which is the phase 1 and phase 2 of like testing a vaccine, we normally enroll people who are younger, and these are people of reproductive age. And because at the time we did not know the effect of the vaccine on pregnancy, or, you know, like a developing fetus, we advise that people who were enrolling into these trials to evaluate the safety of this vaccine, that they should not fall pregnant. In other terms, the women who were enrolled in the studies were asked to have some form of contraceptive means that will make sure that they don't fall pregnant. And obviously, there are some people who, you know, did not either respect that, or who did not plan for this to happen, because we know that there are certain malfunction with certain hormonal or general contraceptive usage. And these people ended up pregnant. And I can tell you that all these women who fell pregnant, whether it was on the Pfizer trial, whether it was on the AstraZeneca trial, delivered a baby, delivered a healthy baby, went to term with the pregnancy, and had no issues whatsoever. And this is why now I can also tell you that these people received the vaccine, but they fell pregnant. So there is no reason to actually think that this can cause infertility. And even right now, we have people who received the vaccine from last year, like in certain countries, that have fell pregnant and that have, you know, had like a normal gestation and have given birth to healthy babies. So there is absolutely no claim in, like, you know, the reduced fertility or the impact on fertility from these vaccines.
And then Shameem Abdu asks, you know, is there any issue in people who have allergies to penicillin for them to take the vaccine?
Not that I know of. People who have allergies to penicillin, people who have allergies to clopidogrel, people who have allergies to aspirin could normally safely take this vaccine. But again, I am not a clinician. I have this information after speaking to clinicians, but I will defer to the medical doctors on site of vaccination, because as I said, they have been prepared, they have been given all the tools, all the information that will allow them to actually inform the people what is safe and what is not safe.
So what you're saying is that if if somebody does have comorbidities or they have particular medical conditions or allergies, they should just consult their doctor that they are
Correct.
comfortable with.
Correct. Yes.
Okay. And then there's a question about pregnancy and breastfeeding women. Can they take the vaccine?
Yes. So what studies have even shown now so far is that the immunity that the mother builds up, when she gets the vaccine or even when she gets infected, can be passed on to the babies. And what I'm talking about now, or what people commonly hear about as being referred to as antibody, right? Antibodies are part of the immune system that we have, and they help us to fight and neutralize certain microbes like bacteria, like viruses. And what they have found is that a woman who has received a vaccine and who produces these good antibodies, the neutralizing type of antibodies, can actually pass these antibodies to their babies through breastfeeding, and in that way also provide protection to the baby. And this is why we normally advise people to breastfeed in most instances, because we know that the baby will benefit from the protection that the mother has against a lot of different diseases. So the same work for COVID.
And then another question, some people say that the vaccine contains fetal cells. Is this true? It's a very common thing that you see, the fetal cell lines. If you could elaborate on that, Shameem.
Yeah, again, briefly, I don't want to go into too much detail. I can assure you that none of these vaccines have any form of mammalian cells, human cells in them, okay? The fetal cell, I think, is mostly a problem that we have with the vector-based system, which are the Johnson & Johnson and AstraZeneca vaccine. Have fetal cells been used in their development? Yes. Do they contain fetal cells? No. Could we have bypassed the use of fetal cell in the production of these vaccines? Potentially, yes. But what happened is that we use these cells because these cells are cells that we call immortal cells, or they are cells that have been, they are cells that can divide and replicate many more times than a normal cell, for example, a skin cell or an eye cell or a heart cell. And the purpose of using these cells is that if we use these cells, we can make more of the vaccine than if we were using any form of other cells. So this is the reason why we use fetal cells. And these cells have actually been isolated from a fetus in 1973. The cells that people are using in the development of these vaccines right now are not from that fetus. They are called cell line. They have multiplied, they have divided millions, if not billions of times until we have what we have now. And we use that in the development of vaccine. And the reason why these cells were isolated from fetuses back then and used till now is that, remember, science in 1973 is not like science as we know it now. We did not know a lot about where to find things. So at the time, we knew that fetal cells are these types of cells, and the fetus can provide us with these types of immortal cells. So we extracted that from these at the time, and because we know the safety profile of these cells over decades of use and their stability, we stick to that for the production of any new vaccine. And this is why we're still using these fetal cells right now. But I can tell you that there are now other parts of the human body that are known to have these cells. The bone marrow has them, but obviously, it is a painful procedure. You're not going to go into somebody's bone marrow to extract these cells. But another part of the human body that has been known and has been proven to have these are the placenta. And I do know that there are endeavors and research work right now that are ongoing to extract these from the placenta and eventually use these for the development of vaccines and any other biomedical intervention, because I do understand and I do respect that people may have issues that are based on religious ground with the use of these fetal cells. But again, short answer, There are no fetal cells in any vaccines that are being used right now, and any other cells for that matter.
Thanks for that, Shameem. We don't have any questions right now, but I would perhaps give some time. We have until 2:30 for this session. You're welcome to ask any other questions. You can type it on the chat as we've been doing, or if you would like to ask it directly, you can raise your hand and we'll unmute your mic. Yeah, so we'll, if anybody would like to ask any other questions, you're welcome to do so. Is there, Dr. Jaumdally, is there anything else that you think, any other questions that you've been asked frequently by other people that you think would be important for others to know? Yeah, okay, I see there is a question. Can someone get vaccinated if they currently have COVID? So I think you...
No, not if you have COVID, for the simple reason that I've mentioned earlier, which is COVID comes with inflammation, the vaccination comes with inflammation. Inflammation under control is good for your body because it's one of the mechanisms of action that your immune system has to get rid of microbes. But when you have too much of it, it can cause damage to your heart and other organs. So this is why we generally advise people to wait at least a month after the complete disappearance and resolution of their symptoms to get the vaccine.
Mm-hmm.
And Ilyas, I think some of the, just while we wait for more questions from the audience, some of the questions and some of the common theme that have come out, through my engagement with people in the community is, things like why do we have a vaccine so quickly for COVID? But then, HIV has been around for over 40 years. TB has been around for like over a century now, and we've been doing research on this, and we still don't have a vaccine or something that works against them. It's very easy to simplify things and compare, like apples to pear and, like to oranges. But the fact of the matter remains that it is a very different virus. Let's remember that HIV actually affects our own immune system. It's kicking you where you actually need to fight. So it's affecting your soldiers that are meant to provide you protection against them. Let's also not forget that HIV, unlike SARS-CoV-2, which causes COVID, the coronavirus, HIV can integrate inside the human genome and stay hidden there. This is the concept of reservoirs. You can have people, you test them, you don't see any HIV virus in their blood circulation. But then after a year, you actually see all of a sudden that person is getting sick and then the viral load shoots up again. It's not because the person got reinfected. It's because HIV can stay dormant and can stay hidden in your body, okay? The other thing is that HIV is a virus that mutates, that changes almost 100 to 200 times faster. And some people say up to 1,000 times faster than coronavirus. So to be able to develop a vaccine that works against something that camouflages itself and that changes so frequently is extremely difficult. And I want to emphasize, while we are on this mutation point right now, that one of the reasons why we want to roll out the vaccine as fast and as urgently as possible is to have this whole epidemic under control, to minimize the risk of the emergence of new variants. Because the more changes that happen in that virus, the less effective it will render the vaccines that we have for use against them right now. We need to make sure that we have it under control, and the only way to get there is to use the vaccine. Again, for TB, I'm not going to talk too much about it. Why do we not have an effective vaccine against TB? TB can stay dormant. TB is something that acts very differently to the SARS-CoV-2, the coronavirus, and we can't really compare apple to oranges, or like grapefruit to oranges or pear. So,
And just ask the question, just to clarify again, why would active immunity from a vaccine last longer than natural immunity from contracting COVID? I know you answered it early on, but if you can just repeat it.
Yes. Yes, it's because when we are designing a vaccine, we know exactly which part of this immune system it will actually tickle and trigger. For example, with the adenovirus vector-based system, we know that the immune system will react to two things. It will react to that adenovirus, which is already a foreign entity in the body, to elicit a part of the immune system to react, but it also contains that part or that code for the coronavirus that will have immunity raised against it. So the immunity that's conferred by an artificial mean is an immunity that we know what it's going to do, and we can have more control of that than in somebody who develops natural immunity. So we've heard now, for example, that so many people stay asymptomatic to the infection. And that's because, their body has managed to clear it really fast. But when you do clear that virus fast, there is an element of the immune system that generally kicks in later that does not get triggered. The vaccine will correct for that because the vaccine has a switch that can be put on and off with regard to these specific parts that are not generally triggered in a natural infection.
Shameem. And
Yes.
yeah, so Abdul's question again. I think your advice was that you're probably looking at booster vaccines down the line. Am I correct? You mentioned that, Shameem.
Yes, there is a possibility that we will require a booster, but obviously, we rely on data that is constantly being produced in people who have received the vaccine, either in trials or in the Sisonke, rollout in the healthcare worker, and obviously we will go with what science tells us.
Hmm. And then just an ivermectin question, Dr. Jaumdally, if you could maybe just speak more on that as a treatment for COVID versus the vaccine.
Ivermectin is something that I follow, constantly because it's something that is obviously very popular in the general community here. I can guarantee you that ivermectin doesn't work for prevention and doesn't work for treatment. There are reliable papers that are randomized controlled trial that are what we call meta-analysis or systematic reviews that have confirmed that ivermectin doesn't work for either prevention or for treatment. Let me be honest with you. I am myself where I am based right now evaluating the treatment of the use of like a specific treatment against COVID-19. But I'm not going to tell you, Elias, listen, I've got this drug right now and I think it works against COVID. Why don't you try it? No, I can't do that. Even though I know the safety profile of the drug that I'm trialing right now is safe, I'm not going to tell you to take it if it doesn't make anything different, if it doesn't protect you. I wait to get my data and I will make a decision and I will make inference after I get my data. And this is exactly what's happening with ivermectin from groups of people who are trialing it and seeing that it doesn't work in any ways, whether to prevent infection or to prevent severe disease. So ivermectin doesn't work. And I want to tell people to not be fooled by the false perception that people are getting better after taking ivermectin, because in the first place, we need to know if these people had a risk of developing severe disease. If me or you, Elias, were taking ivermectin and we already do not have a risk of developing severe disease, but we get COVID infected, and then we don't develop severe disease, do we then say that ivermectin protected us when in all honesty, we would probably have the same profile if we did not take ivermectin? So this is what's happening in the community. A lot of people are taking it after they get infected, or they are taking it to not get infected, and they're putting it down to the use of ivermectin, which is not right.
And also like the levels of evidence that we have in medicine. You sometimes have stories from people,
Yes.
small groups of people, and then you have higher levels of evidence. So you have different types of studies, experimental studies, randomized control cells. And when it comes to ivermectin, when we do the randomized control trial, you were saying that it doesn't prevent you from hospitalization or
No, it doesn't.
disease. So
It does not.
So I think just to make that clear, that your best chance against this virus is not ivermectin, it's the vaccine.
For now, I would even say that the best prevention against this virus is not even the vaccine. It's to be responsible. It's to wear your mask. It's to limit your movement. It's to protect your vulnerable, your people at risk. It's to sanitize. It's to take all these measures, because if we do act, like responsibly, I think we will minimize the transmission. I know it's not easy. I know people need to work. I know certain people need to be out. But what I'm talking about is to limit your movement and limit your engagement that are not necessary, that are social in nature. And that for me is the best prevention. I am a scientist. It's not because of that I'm going to tell you that the vaccine works better than this. No, we have these layers that we first need to apply, because as we see right now, not everybody has access to vaccines. And I respect the choice of people not wanting to take the vaccine, especially if they feel that they are not at risk of developing severe disease. My narrative, I generally limit that to people who are at risk, people who are at risk of developing severe disease and dying from that. These are the people I am trying to protect. And in the bigger picture, these are also the people who we are trying to protect with the rollout of the vaccine.
Okay, and there's another question which says, if you've been vaccinated and have been in contact with someone who has had COVID or has COVID, should you still isolate?
Definitely. I've had people come to me who have received either the Pfizer or the Johnson & Johnson vaccine and who've been infected. And yes, you need to isolate. I've got lots of colleagues and friends who are doctors who have received the Johnson & Johnson vaccine and who got infected during Eid, and they had to self-isolate. As I mentioned, a vaccine will not guarantee that you don't get infected. The Pfizer vaccine has shown efficacy against infection and transmission to a degree, but the Johnson & Johnson vaccine has not shown that, and we should not make inference based on anecdotal report. And I can tell you that I personally know people who got the vaccine and who got infected and who developed symptoms, right? So yes, again, you should not be blinded by false sense of like protection when you get the vaccine.
Okay, thanks, Shameem. What is the best response to those who claim that the mask does more damage?
I will use simple logic. We all know that in Southeast Asia, people wear masks all the time there. And the reason why people wear masks all the time there is, one, pollution. Two, because this is the hotspot for the emergence and circulation of a lot of flu-like viruses. And again, where do we think COVID-19 comes from, the virus that causes COVID-19? From around that area in China, in Wuhan. And these people have been wearing masks for years. And what has happened to them? Has anything been reported on these people who are all wearing masks? I mean, you go to Japan, you see people everywhere wearing masks. You go to certain areas of China, you see people wearing masks. So no, I don't understand why all these issues that have been in practice for so long are only becoming relevant now that we have COVID-19 around. This is what people need to think about to allow them to make a concerted judgment on something.
Yeah, I think there is also an argument to be made that the incorrect wearing of the mask may do damage, because a lot of people are not wearing the mask correctly. You're supposed to wear it over your nose and your mouth, and you shouldn't actually touch the front of the mask. And unfortunately, that isn't something that is practiced. So in that sense, you could actually be doing some damage there, but you'd be encouraging people to wear the mask in the correct way. Right, Shameem?
Yes, definitely. For example, you wear it, you cover your nose, you cover your mouth. You don't just cover your mouth, a lot of people wear it this way. We should also be thankful that in South Africa, it's not too humid. So when we actually wear our mask, we don't feel too suffocated and we don't feel like it's like very uncomfortable. I mean, I'm from Mauritius and I can tell you there that all my friends, all my families are complaining, you know, like, how do you wear this mask? Like, the first question that I got was like, I need good mask. Like, can you give me a good mask? I'm like, what do you mean good mask? They're like, no, we need something that's comfortable. And for me, I immediately thought, like, you know what, like, your comfort is what is not what counts here, but it's your safety. You need to wear something that works, right? But I also do appreciate the fact that, people need to have some comfort. I mean, I myself, I don't use a surgical mask. You know what I use? I use an N95. I have access to them, so I'm thankful for that. I can wear it. But the reason why I wear an N95, let me just show you. Okay. So when I put my N95 in place, you can see that the elastic band is like really tight. So once I have it in position, as opposed to a surgical mask that can slip down and that you need to readjust all the time, in the morning, once I put that mask there, I don't need to touch it for hours. It will stay in position. And you can say, because I wear glasses, they can fog up if you have like any form of like, like outlets or like, like places that are not like tight enough. I don't get that with my N95. So it's about finding what is comfortable for you. And no, there is absolutely no risk that masks do damages.
Yeah, so Rian says, thank you for the session. Having similar ones in the future would be great. And that's also something that we would like to gauge, from the audience. This is, I think, the first time that we're doing it in this style, trying to make it very informal. And if you feel that this is something that others will benefit from, if you think we should have more of these sessions, please let us know. You can let us know in the chat. We've got 30 people here. But I'm sure there are lots of other people out there who maybe are a bit hesitant about taking the vaccine, and they really need to have the tools to make an informed decision. So if you feel like this is something that people would benefit from, please let us know. Yeah, thanks, Debbie. Are there any other last questions? We're supposed to close off at 2:30, which is in 6 minutes. So Saida asks, how long does immunity last if you have had COVID? So via natural causes, yeah.
So your immunity will normally last 3 months. And the reason why we say 3 months is this is the timeline that we understand is in place before somebody is at risk of getting reinfected. So basically, it takes around 3 months for somebody to get reinfected with either the same virus or a different virus, which is a variant. That's why we say it lasts 3 months.
Okay, so natural immunity, 3 months. Johnson & Johnson, do they have a timeline on how long that immunity lasts? Some people
right now they say up to 8. They say up to 8 months. But again, I'm not going to linger too much on that because data is still coming out. I mean, look at the flu vaccine, the seasonal flu vaccine that we have to do every year. So, with the emergence of variant, there could be a possibility that we find ourselves in a situation where there is going to be a cocktail of different types of variants that are in circulation around the world, put in one vaccine, and then they administer that to people every year, at least for a certain number of years until we have coronavirus under control. And right now, it's kind of pointless for the big countries, the wealthy countries, to vaccinate all their people and forget about, like the lower and middle income countries, because there is global travel. What tells you that, you in the UK, you vaccinated all your people, now bars are opening, nightclubs are opening, you want to go back to normal life, and then you have somebody from India or from South Africa who comes into your country with like a virus that has mutated so much now that, your vaccine that you gave your people doesn't recognize it anymore. Then it's back to square one. So we have to keep an open mind regarding the duration of immunity and also the efficacy of that immunity with the growing trend of rising variants in different parts of the world.
sort of making the argument for universal vaccination as opposed to just vaccine nationalism.
Correct, correct, correct. Yeah. And I think we will get to a point where we may have vaccines made by different companies and suppliers, but we will get to a point where we will have one common unified vaccine for use across the world in terms of the type, and this is the case, for example, for yellow fever, for many other infectious diseases that we have right now around the world. We use one type of vaccine, and that's why you don't have a need to have like a global vaccine passport. But right now, obviously, it is like what we call a novel. It is an emerging disease. It is a novel virus, and we're still learning.
Yeah, and we're always going to be learning, and we have to just
always we have to stay humble, and we have to remind ourselves that we cannot know everything, and we can only learn more through the process of doing research, and keeping an open mind, and also listening to people. And I prone that. I actually prefer to have engagement. I don't mind speaking to people who have conspiracy theories to to talk about. I would prefer to talk to these people and understand, where's that coming from? How can I give you information that will make you, better at taking your decision?
Yeah, and that's really the essence of these sessions. Couple of minutes left. Are there any other final questions before we close off? Yeah, there's a question on sort of early in the pandemic. There were talks about what 5G and COVID.
Yeah, again, very, 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 very brief, very rational answer. There are so many countries where 5G is not yet rolled out, and you have COVID there. So that would probably indicate that 5G is not the one responsible. The next thing we hear is that now they're selling microwaves that can actually give you COVID. So no, 5G doesn't cause COVID, and that's as rational as that. You have COVID everywhere, and 5G is not everywhere.
Any other last questions? I see we've had mostly text questions, but you're also welcome to raise your hand and ask a final question before we close the session. How long does one wait before exercising post-COVID? We haven't actually asked that one yet. Yeah.
Yeah, so generally, I would prefer a clinician to answer that question, but you have different degree of severity of disease that you develop after an infection. And there are people with what we call post-COVID lung disease, which is basically a long-term implication and sequelae that you develop after you get infection that may limit your activities that you would routinely do. I think for people who've had like moderate disease, as soon as you feel a little bit better, you can start exercising. For people who have had a disease that was severe enough for them to require hospitalization, I would defer to the doctors, and I would actually rely on their opinion on that matter, because there may be further things that they want to consult, such as your imaging for your chest, because that's one of the main part of your body that gets impacted and that gets affected by the infection.
So basically, clinical questions, speak to your nearest GP that you're comfortable with.
Correct. Yeah. Correct.
Okay. I think just we'll wait if there are any other last questions. And then just, if anybody is typing, just to say that this is the first time we're doing something like this with Dr. Jaumdally, and if you feel there's a need for future sessions, obviously as things evolve, as knowledge changes, we really appreciate that feedback. And I think we, Dr. Jaumdally has indicated that he would be willing to have future sessions. Babalwa asks, what is long COVID?
Long COVID basically is what people suffer from if they have been really affected by the infection. So these are people who have had like prolonged hospital stay, and people who have been in ICU and intubated because of COVID-19. and these people have reduced function, whether it's their lung, whether it's their heart, whether it's their physical ability to walk and do what they would do normally. This is what we call long COVID. And unfortunately, it is like a reality in a number of people who get in hospital because of COVID.
And does that also include people who experience symptoms like long after they've been discharged? Because I know some people are still having breathing issues.
Correct. Correct.
Yeah.
Yes. Yes. Ilyas, I'll have to rush to another meeting very soon.
Okay, yes, it is past, so I think we'll close off the session there. Thanks to everyone for coming. I think there's been quite a lot of positive feedback, so I think we will definitely consider organizing a follow-up session for more people, but please keep on spreading the word, and I hope that you have an enjoyable day. Yeah, thanks, Dr. Shameem, for your time.
Thank you. Thank you for that platform, Ilyas.
Yeah, thanks for sharing your knowledge. Okay, have a good day, everyone.
Okay.